So we are going to talk today about kidney, right? So have you have any idea about kidney or not? So how many kidneys do you have? What are they called? So right kidney, left kidney, right? Okay. So where they are placed? Lumbar region. Related to which wall of the abdomen? Anterior or posterior? That makes this organ and like a interperitoneal or retroperitoneal. What do you mean by retroperitoneal? Outside peritoneum, that means in space, interstellar space.
All side is not covered by the pelvis.
All covered. Which side is covered then?
Posterior side is not covered.
Posterior side not covered. Why? Fixed to the posterior pelvic wall, posterior abdominal wall. All right. So what's the normal location of this kidney? T12 to what they are? T12 vertebra and L3 lumbar vertebra. Looks like some space missile you are talking about, right? So right and left, out of these two, they are hanging at the same level or somebody is different level? This one is higher. Oh, lower. Why? What happens to the liver? Because of the liver, it down. Why? Because that's the nature of liver, pushes everything down, right? Suppresses other people. Bully guy. So okay, big body, liver which is present on the above, on the right side, pushes it down. Now, what are the parts of this particular kidney? How do it look like? Bean shaped. How many surface? What are they called? What are the poles? How many poles are there? What are they called? How do you going to identify upper and lower? Upper is round and lower is more flat. Okay. All right. So how many borders it has? What are the borders? How do I identify which one is lateral, which one is medial? Hilum is present on? Now how do you identify this medial side hilum? What's the special feature of hilum? Renal artery, renal vein, renal pelvis, and ureter. So they are on hilum. How they are placed? Vein, artery, in which direction? Anterior to posterior. Okay. So anterior to posterior. Most posterior is pelvis. Most anterior is which vein? Renal vein. Renal veins drains into? You need some instrument to hit each other. হাতেই হবে তো মারপিট করে বলে না ঠিক করে নে কোথায় কোথায় বলবি. So how many kidneys are there? You mentioned that right and left, right? So how many renal veins are there? 2 renal veins. So where do they drain? Right vein, right inferior vena cava, left inferior mesenteric vein. Which one? কাকে ভোট দিবি? দেখ ভোট আসছে এখন থেকে মন ঠিক করে নে. So which one? Accessory renal vein. Accessory hemiazygous. So this left one drains to accessory hemiazygous. Okay. Any other wild ideas? IVC. That's final answer. IVC. 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 Accessory azygous vein. Accessory azygous vein. 1, 2, no wires. Sold. Only you. Inferior mesenteric vein. 1 wire. Second wire. sold, wrist, drains nowhere, stops there, right? বাদ বাকি যারা আনসার তুললেন হাত দিলি না তাহলে কি, those who are not answering, left renal vein for them drains nowhere, it stops there. Forget, we do not have a left kidney, so how to drain? Left kidney stolen, so right side it find a guardian, like it drains into it. Left side guardianless, nowhere to drain. Find left side where it drains. Find it now. IVC, IVC, IVC. बोल IVC, IVC, IVC. ভুল লেখা আছে, পাতাটা ছিঁড়ে দিলে IVC লেখা আছে, ও বলছে দাঁড়া বইটাই ছিঁড়ে ফেলবো আমি। So both of them drains into inferior vena cava. That's final answer, right? Agreeing everybody? Everybody casting their vote to IVC, or you have something else to in mind? Final answer though? Okay, IVC. Which has more length, right or left? Left renal vein has length is more. Why? So it's the length is more. Okay, what's the blood supply, arterial supply to renal vein, renal artery, renal artery? How many of them are there? What are they called? Where from this artery is coming? Abdominal aorta only? Any other idea? Inferior mesenteric artery, superior mesenteric artery, only abdominal aorta, thoracic aorta, arch of aorta. দেখ হতেও তো পারে। আমি তো আইবিসি দিয়ে বলেছি, ও বলেছে আইবিসি দিয়ে বলেছি, আমি আর্টারি বলছি, ও বলছে আইবিসি দিয়ে দেবো। আইবিসি দেবে, আর্টারি বাটি কেউ দেবে না, সব আইবিসি। রক্ত আসবে আইবিসি থেকে, আবার রক্ত যাবেও আইবিসি, মানে ভোট আমি একজনকেই দেবো, ছাপ্পা ভোটও হোক, লিগাল ভোটও হোক। So inferior vena cava থেকে ব্লাড আসতে পারে তো? Renal artery is coming from inferior vena cava? No. Why? Why no? Venous drainage. Other one is arterial drainage. So renal artery both are sourced from abdominal artery. So which has more length? Right renal artery or left renal artery? Right renal artery. Length is more. Why? Okay, fine. All right. So how many axes this kidney has? Axis. Axis. 2 axes. Vertical axis, transverse axis. So this vertical axis is running vertically and other is horizontal or transverse axis, right? So this one is upper pole is tilted medially. So the kidney upper pole is tilted medially, right? Lower pole is little bit away, and this transverse axis which you are seeing here, this one which is having this hilum going through, is directed backwards, posteriorly towards the posterior side, like this way. So if you are holding this kidney in anatomical position, upper pole, if you are identifying it, it will be straight, tilted, and it will be backward. So hilum should be down backwards, alright, both of the cases, because of the axis which is there. Now this particular kidney is covered by fascia, capsules. How many capsules are there? What are they called? True capsule, true fibrous, suprarenal fossa, renal fossa. So how many capsules are there? We call them as true capsule, false capsule. We divide that into true capsule and false capsule. What is true capsule? What is false capsule?
True capsule is fibrous.
True capsule is fibrous capsule, outermost, and false capsule is
Membranous ছিল না
membranous chilo. Our coach. How many coverings are there surrounding this capsule? Fat chilo. Ki chilo? So it is a double cheese burger. One layer cheese, again one layer cheese. 2 layers of fats are there, 2 layers of capsules are there. Find the names of it. Inside, outside.
স্যার
সবার
সবার বাইরে ফাইব্রাস
বাইরে সবার বাইরে কি আছে? আচ্ছা, ইনসাইড আউট আর আউটসাইড ইন? ইনসাইড আউট, মোস্ট ইনসাইড?
তারপরে
No, 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 no. There are 2 things are there, fats and fascia, which are known as capsules, right? Now, how many layers of fats are there? How many layers of that makes 2 and 2? Now say it like most interior
fibrous layer,
fibrous capsule, fibrous layer, then
perirenal,
fat, fat, then
renal fascia, এটা false capsule,
then panel fat. So double cheese, burger, hamburger. All right. Out of these, fibrous one is modified or from the gland itself or from the organ itself. Then we have the layer of fat. Then we have this renal fascia, and then we have the fat layer outside. So if you strip off this particular fat, then you get this RF, renal fascia. Renal fascia is a short note that you have to prepare. So how many layers of renal fascia is there? 2 layers. What they called? Anterior, anterior, posterior. Fine. What happens to this particular posterior layer? Posterior is continuous with which layer?
sir fascia transversalis,
Posterior layer is posterior layer is continuous with something which is layer which is posterior. What lies on the posterior side? আরেকটা ভাষা আছে, psoas fascia. So posteriorly it is continuous with muscle which is lying there. We have muscle which is on the back side, psoas muscle, which is having a covering, psoas fascia. Right? Laterally it is bending on fascia transversalis. Anteriorly it is continuous with the other side, renal fascia. Right side continuous with left side. Inferiorly, you cannot trace it properly, goes along the ureter. Above, most important. So on top of this you have suprarenal. So what happens? This above layer encloses here and then splits, and then again splits to enclose this particular suprarenal, and then hits to this roof, which is diaphragm. So if you're seeing from the side, the suprarenal and the kidney, which is like this, so this upper layer of renal fascia is continuous, closes on the upper pole, then again splits, covers this suprarenal and goes to under surface of the diaphragm. So as this together is connected to the diaphragm, with respiration should be moving or not? Should be moving. No. Why not moving? Moving? Diaphragm move করে with respiration. Diaphragm যদি মুভ করে এই লিগামেন্টটা মুভ করবে ডায়াফ্রামের সাথে, তাহলে ডায়াফ্রামের সাথে যদি মুভ করে এইটা কভারিং উইথ মুভ করবে, করবে? তোর মাথা ধরে উপরে টানলে উঠে আসবি, আসবে? So moves with respiration or not? Because diaphragm moves. So diaphragm move করলে কি এসে গেল? So if diaphragm moves, why this particular kidney moves? Renal fascia attached to diaphragm. Which surface of diaphragm? Inferior surface of the diaphragm or under surface of the diaphragm. So renal fascia is important for attachment and splits. Now, what's the beauty of this? If you have a tumor of SR, or if you have a tumor of kidney, this renal fascia plays a role. So if you have a tumor in the suprarenal, you can remove the suprarenal gland leaving this kidney. And if you have a tumor in the kidney, you can leave this particular suprarenal gland, leaving this kidney out without hampering anything anatomically, because they are separate. They can be separated out because they are splitting, closing, and again splitting, closing. Here, so that's why this particular renal fascia have got clinical importance. One thing, movement of the kidney. Other thing, surgically they are resectable without damaging each other. Here, okay. Now, coming to kidney, if you cut this kidney, we get this particular kidney having divided into 3 spaces. What are these spaces called? Cortex is most outside, then we have medulla, and then we have sinus. How many spaces kidney has? What are they called? Cortex, sinus. Sinus is the empty space into which the collecting system of the kidney which gets into. What are the collecting system of the kidney is known? We call them as calyces. They are looks like claws, hands like this. So this particular claws, small one, minor, small two small, 3 small unites, major. So minor calyx unites together, major calyx of them 3 or 4 uniting to form RP, renal pelvis. Renal pelvis goes down to the lower pole of the kidney. Then we call this renal pelvis as ureter. So till this particular kidney, this pelvis is dropping down, crossing the lower pole. Then we change this from renal pelvis to ureter. Okay. So this particular kidney, if you see in front of this particular kidney, in front of this particular sinus, we have this renal parenchyma. Renal parenchyma is divided into cortex and medulla. Into this, we have this particular body. We call them as renal pyramids. This particular renal pyramids, in between them, we have tiny space. We call them as renal columns. So the renal columns, renal pyramids. Renal pyramids has a base which is direct toward the outer side or cortex side, and this particular apex which is directed towards sinus or calyces side. This renal pyramids is filled up with the collecting ducts. The kidney has got secretory and functional unit which is known as nephrons. They have a capillary turf, we call them as, then it has a expanded part, Bowman's capsule, then ECT, loop of Henle, collecting ducts, and then it goes out with this particular cortex and forms the urine which has been formed, filtered, which drops in here and collected to eventually dropped into, stored in the urinary bladder. Okay. So these are the things which works here. Now this particular renal sinus, which is the space between this particular renal pyramids, this particular sinus is the paved walkway. What runs through here? Arteries, veins, nerves, lymphatics. What arteries? Branches of the renal arteries. We call them a segmental or lobar artery, interlobular artery, and eventually they makes an arch going to margins of it. We call them as arcuate arteries, and then arcuate arteries branches again to give these small branches, capillary branches or like this, and they gives the glomerular branches as well. Eventually forms the turfs of glomeruli and comes out. So this particular kidney have got internal structure and external structures, and that have organs which are related to this particular surfaces of this particular kidney. So this kidney have got anterior surface and posterior surface. Now this anterior surface is related to the organs, posterior surface is on the wall. What wall? Posterior wall. So posterior wall relationship. On the back side we have the ribs, right side, left side, 3 2. Likewise, if it is high up in position, 3 ribs will be placed. If it is lower in position, there will be 2 ribs in place. The lower 2 or lower 3, depending on if they are there. 12, 11, 10 or 11, 12, depending on how much they are placed. If they are in a higher position, they will have a relationship of the ribs 3. If then low, lower ribs. Then we have this diaphragm. Diaphragm has your ligaments, we call them as arcuate ligaments. They are related to these arcuate ligaments. They are looking like arches. They are known as arcuate ligaments, which are having this particular kidney on the posterior relationship. And then we have muscles, medial to lateral. What are the muscles we see most medially? Psoas major, QL, transverse abdominis. These are the uniform things related to the back side. So if it is this, you can consider this pillar like this. So this on the pillar you have this particular psoas major, then likewise, and on the top we have the ribs over there. Below the ribs we have the arcuate ligament, which is giving rise to the diaphragm. They are constant in right side, left side, and on top superior surface is covered by this particular suprarenal gland, which is related to the posterior surface relationship on the kidney. Clear? Now coming to the anterior side, the right side kidney and left side kidney. What could be the organ related to this particular right side kidney and left side kidney? So we take at a time. Right side? Okay. So what organ could be nearby? Upper suprarenal gland. তারপরে liver. Duodenum কোথায় থাকবে? কোনখানে থাকবে? Medially. Medially মানে কোন জায়গায়? কোন border? Hilum. Duodenum. তারপরে colon. Colon কোথায় থাকবে? Medial border, lateral border. Lateral border, laterally placed, because this is placed laterally. Laterally colon থাকবে, এরকম করে উঠে আসছে তো, then bend হচ্ছে, তারপরে আর কি থাকবে? আচ্ছা, জেজুনামও থাকবে। জেজুনাম কোথায় থাকবে? নিচের দিকেই থাকবে। All right, so these are the right side relationship that could be present on the right side, left side. So above we have suprarenal in the top, then we have the liver, then on this side you are saying this will be related to D, duodenum. Here on this side it will be related to the colic flexure, and jejunum will be there. Anything else? আর কিছু থাকতে পারে? Fine. Compared to the left side, what could be there on the left side? Suprarenal, stomach. Stomach টা এরকম করে থাকবে, তাই তো? Stomach, spleen, right? Spleen, pancreas, pancreas এরকম হবে। Colon, jejunum. Okay, so jejunum, colon, likewise they will be related. So yes, বাহ, ভালো হয়ে গেল। So these are the things that will be related to this particular organ, anteriorly and posteriorly, likewise related to this particular element. Now, oh হ্যাঁ, নার্ভগুলো দেখা যেতে পারে, ঠিক। So the nerves which is present on the posterior abdominal wall, সবার উপরে কি থাকতে পারে? সাবকস্টাল, তারপরে ইলিও হাইপোগ্যাস্ট্রিক, ইলিও ইঙ্গুইনাল, আর কিছু থাকতে পারে? ফার্দার ল্যাটারালি তো আর কিছু থাকবে না, এদিকে ল্যাটারাল কিউটিনিয়াস নার্ভ অফ থাই তো পিছন দিক দিয়ে সাইড দিকে আসবে, কিডনিতে থাকবে না। সো 1 2 3 ব্লাড ভেসেল থাকতে পারে, সাবকস্টাল ভেসেলও থাকতে পারে, অ্যালং উইথ দ্য সাবকস্টাল নার্ভ ব্লাড ভেসেলও থাকতে পারে, সাবকস্টাল ভেসেলস বলে, right, on the posterior side, so it will be related to it. Now on the back side we have a muscle next to this vertebral column, we call them as erector spinae, which is more or less present vertically, right? And on the side here we have the 12th rib. Now the junction or intersection point between them, we find an angle. This angle we call them as renal angle. Now this renal angle can be traced on the back side. How? You can identify the 12th rib, you can identify this particular erector spinae, and then at this particular junction, if you trace that particular point, that should be touching this particular hilum of the kidney. Now, if the kidney is affected, infected, have any problem, this renal angle can be tender. That means, what do you mean by tender? What do you mean by tender? Batha. So if you press there, ওরকম করে বসে থাকবে না, কি করবি? কর, হ্যাঁ কি করবি? ব্যথা হলে কর। So the tender renal angle will be there in case of the inflamed kidney. Okay. So renal angle is the point where we actually target to do the surgeries. The kidney, if you are going to do the surgeries, how you are going to do that? Because just check the patient with the kidney problem, you are going to operate. अब समझाओ कैसे ऑपरेट करना है, मैडम जी ऑपरेशन करना है किडनी का, कैसे करेंगे बताइए थोड़ा. So how you are going to do that? If you have to do a surgery on kidney, how you will be approaching it? इरेक्टर स्पाइन से ऊपर. That means कैसे समझाएंगे आप हमें? समझाइए, मैं आपका पेशेंट हूँ, आप समझाइए क्या करेंगे मैडम. मैडम जी मेरा किडनी स्टोन है, कैसे ऑपरेट करेंगे आप? की रेनल एंगल की करे बोझाबी. So kidney is approached from front side or back side? Why?
It is more to the posterior. আর posterior structure so কম.
এবারে পেশেন্টকে বল, আমাকে বল কোন দিক দিয়ে অপারেশন হবে ডাক্তারবাবু? ডাক্তারবাবু পিছনে ছুরি মারবে, ব্যাক স্ট্যাবিং কেন পিছন থেকে ডাক্তারবাবু? সামনে কি হলো আমি তো দেখতে পেতাম. তাহলে
সামনে বেশি অর্গান থাকে.
কি অর্গান থাকে?
বিভিন্ন রিলেশনশিপ করলো
বলে ফেল. এত কিছু আছে, এই শোনো শোনো আমার এত কিছু আছে. তাহলে সামনে থেকে করা যাবে না, তা পিছন থেকে করতে হবে. এবারে পিছন থেকে করতে গেলে কি করে করবে? স্কিন কাটতে হবে, কাটতে হবে. কোথায় কাটবেন ডাক্তারবাবু? কোমরের পাশে কাটবেন, মিড লাইনে. ইট ইজ মিড লাইন. শীত দ্বারার উপর দিয়ে কেটে দেবে, শীত দ্বারা পাশে কাটবে. শীত দ্বারা পাশে কাটলে তো কি একটা মাসেল আছে বললো, কি মাসেল আছে? ইরেক্টাস স্পাইনি. ইরেক্টাস স্পাইনির উপর দিয়ে কেটে দেবে. इरेक्टस स्पाइन केटे 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 काट काट के छील छील के खा जाएंगे, ऐसे बताए. इरेक्टस स्पाइन काटेंगे তারপর ইরেক্টই হতে পারবে না পেশেন্ট, আর দাঁড়াবেই পারে না. মানে পেশেন্ট সাকসেস, অপারেশন সাকসেসফুল, পয়সা ফুল পেড, পেশেন্ট আর আরেক্ট হতে পারছে না, এরকম হয়েই থাকবে সারা জীবন. So you will be cutting erectus spine or not cutting erectus spine? Not cutting. Change your mind. Erectus spine আছে ঠিক আছে, সোজা যদি না হতে পারে বাবু বেঁকে থাকলে আরেক বিপদ. না লাভ আছে, আপনি বেঁকে আছেন সোজা করার জন্য আবার পয়সা নেবো. So erectus spine you will cut it or not? Then you will leave erectus spine. Spine or spinous vertebra you are cutting or not? Then where you going to cut? Erectus spine and 12 number division. Which border of erectus spine? Lateral border of erectus spine and 12 rib. 12 rib. Good. How you are going to kind the 12 rib? কি করে খুঁজে পাবে? লাস্ট রিবটা খুঁজে দেবে, বলে তলা থেকে শুরু করব, প্রথমে যেটা পাবো সেটাই. বেশ, ও ওরকম ভাবে খুঁজবে. তোরা কিভাবে খুঁজবি? তোরাও কি তলা থেকে খুঁজে খুঁজে উঠবি? প্রথমে পাবো এইখানে, এটা হাড়ের মতো লাগছে, অ্যান্টিরিয়র সুপিরিয়র এক্সপান্সের সামনে ছিল, এটা তাহলে নয়, এটাই 12 নম্বর ডিপ হবে, তাই তো? কি করে খুঁজে পাবি 12 নম্বর রিবটা পিছন থেকে? হাউ টু কাউন্ট রিবস ফ্রম ব্যাক? ফিজিওলজি পড়িয়েছে? ভার্টিব্রা কাউন্ট কর 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 ভার্টিব্রা কাউন্ট কর. ও ওখান থেকে স্টার্ট করবি, কোথা থেকে? সার্ভাইকাল ভার্টিব্রা. কত নম্বর সার্ভাইকাল ভার্টিব্রা হবে? C7, 7 নম্বর. তারপরে হ্যাঁ, তারপরে কাউন্ট করে বল. হ্যাঁ, তারপর কি করে কাউন্ট করবি? C7 কাউন্ট করলি, কোথায় C7? না কোনটা C7 কি করে বুঝবি? কি করে কাউন্ট করবি? 1 2 3 4 কি করে লেখা আছে নাকি? 1 গোনা গেছে, 2 গোনা গেছে, ওপর থেকে কি করে কাউন্ট করবি? ওই তো সামনে আছে পেশেন্ট, দেখ কাউন্ট করতে. অ্যাটলাস দেখা যাচ্ছে না, মানে পরে কেউ শিখবি, আর কেউ শেখাবে না। আমি শিখিয়ে দিলাম, এটাই শেষ, আর কেউ শেখাতে আসবে না তোকে। আমি বলে দিলাম তুই লিখে নে, পরে আর কেউ শেখাবে না তোকে। কি করে কাউন্ট করবি রিবস? ফিজিওলজি স্যার শিখিয়েছে রিব কাউন্ট করতে? সামনে শিখিয়েছে, পিছনে তো শেখায়নি। স্টার্নাল অ্যাঙ্গেল শিখিয়েছে। তো কি বোকা না স্যাররা, পিছন থেকে কাউন্ট শেখায়নি। তোরা গিয়ে বলবি, গলা চেপে বলবি নাকি? না না, গলা চাপিস না, এমনি বলবি সামনে থেকে শিখিয়েছেন, পিছন থেকে বলেননি কেন? আমার আবার কিডনি সার্জারি করতে বলে পিছন থেকে, আমি কি করে করবো? হ্যাঁ, সামনে থাকে, ওটা পিছনে নিয়ে যাবো কি করে আমি? তাহলে কি করে হবে? হবে না তো। দেখুন, একটা সমস্যা হয়েছে আপনার পেশেন্টের। আমাকে আমার স্যাররা সামনে থেকে রিপ কাউন্ট করতে শিখিয়েছে। আপনার অপারেশন হবে পিছন দিকে, আমার 12 নম্বর কাউন্ট করতে আমি জানি না। আপনি কোনো ডাক্তারবাবু খুঁজুন যে পিছন থেকে আপনার 12 নম্বর রিপ কাউন্ট করতে পারে, তারপরে খুঁজে নিয়ে দাগ দিয়ে আনবেন, তারপরে আমি অপারেশনটা করবো। রিপ ক্যান only and always be counted from front side. That's why তোমার ফিজিওলজি টিচাররা শেখায়নি। Rib cannot be counted from back side. So you have to take it. Count it from the front, highway or my way. So count it from the front. সামনে থেকে কাউন্ট করে পিছন দিকে মারবে। ফ্লোটিং, তো ফ্লোট করছে। হ্যাঁ, তো কি করে বুঝবো? ও তো ফ্লোট করে আছে, লেগে নেই তো কোথাও। হ্যাঁ, মানে 12 নম্বর রিপটা কোথাও লেগে নেই, ফ্লোট করে আছে। হ্যাঁ, ওকে পিছনে লেগে আছে তো। তো ওটাই তো বুঝতে হবে, তো সেই জন্যই তো তোকে পড়তে হবে অ্যানাটমিটা। তো বাড়িতে বুঝিয়ে বই বন্ধ করে ঘুমিয়ে পড়লে তো হবে কি করে? ফিজিওলজি স্যারকে কাউন্ট করতে শিখিয়েছে, ওখান থেকে করে 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 কাউন্ট করে করে যেতে হবে। 1 2 3 4 5 6 7 8 করে করে পিছনে যেতে হবে, অথবা জানতে হবে কি করে পিছনে রিপ কাউন্ট করতে হবে। কি করে জানতে হবে? লাম্বার ভার্টিব্রা কি ল্যান্ডমার্ক আছে এখানে? what is this particular line which is joining this particular highest point of the iliac crest? এই লাইনটা, এই যে লাইনটা পাস করে জয়নিং highest point of the
at the body of L3 the
transtubercular plane, তাহলে L3 L4 ভার্টিব্রা এখানে আছে, তার উপরে যাওয়া যেতে পারে। একটা দুটো 12তে পাওয়া যেতে পারে। L3 L4 তার জাংশন, তার উপরে করে করে কাছাকাছি, অথবা সামনে থেকে যখন করে যেতে হবে, তাই তো?
স্যার পাইলোরাস যে আছে ওখান থেকে ট্রান্সপাইলোরিক প্লেনে যাচ্ছে, ওটা তো লোয়ার বর্ডার অফ দ্য L1।
হ্যাঁ, আচ্ছা, পাইলোরাস ট্রান্সপাইলোরিক প্লেন দিয়ে করতে হবে। এই জমিয়ে রাখিস তো বুদ্ধিগুলো কৌটোর মধ্যে, ভালো করে জমিয়ে রেখে দে, আস্তে আস্তে করে, তারপরে প্রয়োজন হলে পরে বার করবি আর কি। তো এইগুলোই তো শিখতে এসছিস। হ্যাঁ, মানে so counting the 12 rib, you reach to the point, the renal angle, do the surgery, তারপরে বলবি গ্লাভস পরবো, ড্রেসিং করবো, then thing comes. প্রথমে তো বোঝাতে হবে আপনাকে এইভাবে কাটবো, গলা কাটবো না, কাটবো পকেটটা। প্রথমে পকেটটা কাটবো। প্রথমে আপনি আমার অ্যাকাউন্টে 1 লাখ টাকা দেবেন, 1 লাখ টাকা। তারপরে কিস্তিতে আপনি আমাকে কিডনি, যে অপারেশনটা অর্ধেক হবে কিডনি পর্যন্ত পৌঁছাবো, আবার 1 লাখ টাকা দেবেন। তারপরে কিডনি অপারেশন করে বেরিয়ে চলে আসবো, কিন্তু জুড়বো না যদি 1 লাখ টাকা না দেন। 3 লাখ টাকা দেওয়ার পরে আমি আপনার পুরো সার্জারি করব। তারপর পেশেন্ট বলবে হ্যাঁ, তারপরে আপনি টাকাটা নিয়ে বাইরে বেরোবেন, আমি নিয়ে চলে যাবো। রেকর্ড হচ্ছে তো, জানি তো, এই জন্যই তো করছি। তারপরে ইউটিউবে ছাবে, সব জায়গায় যাবে, ফেমাস হয়ে যাবে। So going to the renal angle, we are going to do this particular surgery and reach to that particular point. Counting the 12 ribs is most tricky thing. If you miscount it, if you go to the 11th space or 11th rib, if you fail to identify the 12th rib correctly, which happens because of the 12th rib, many a patient has got small 12 ribs. So you have to be doing a chest x-ray. make sure that 12th rib is there, and length of 12th rib is normal appropriate. If you have a very short 12th rib, that's very problem, because you miss the counting of 12th rib. During surgery, you may mess up, and instead of 12th rib, you counted 11th one as 12th rib. Now, what happens if you count this particular 12th rib or miscalculate the 12th rib with 11 is that at this 11th rib lower border, we have on the back side encroaching here is the lung with the pleural covering. Now, you cut it here at that point, you cut this particular pleura along with. What happens if you cut the pleura? Pleural effusion? We call them a pneumothorax. What happens if you have pneumothorax? Air in the lung? Air in lung? No. Air in pleural space. What happens if you have air in pleural space? Collapse. Lungs will? What happens to the patient if the lung collapses? So that's the problem. Apparently, you have to have a precise anatomy knowledge, or else you have a botched surgery. And then, you know better than me how to evade. You should have a double passports, nearby area where you can find any international border, swim across the river or run through this particular barbed wire, go to a different country. So again, if you expose with this proper space, then you get this particular coverings of the kidney. What coverings you are going to get? Outside one? Fat. Then kidney actually. So this is how these whole things are scripted. Now, whenever you are going to have this particular kidney, in examination you have to have this particular kidney identifying the sides, right side or left side. You have to identify it, and then you have to identify this medial border, lateral border. Then you have to identify this anterior and posterior on it, right? So, how to identify this particular medial side and lateral side? You know, hilum is there. Hilum is on lateral side, or medial side. On hilum, structures is there. Again, what structure is there? Renal vein, pelvis. Pelvis will be? How to differentiate between the renal, pelvis or ureter with the rest of the structure?
Pelvis are lower border of the kidney, then after the uterus.
Now see, this is the kidney. The pelvis comes out like this. It is going to drop. So, it is dropping towards the lower pole. Now, you may miss the upper pole and lower pole. To identify this upper pole and lower pole of the kidney is that if you have this particular kidney placed in properly in anatomical position, this ureter should be dropping smooth without any bend. There will be no kinking. And if you have falsely identified this lower pole as upper pole, many times it happens, this ureter will be flipped, and if it is flipped, it will be making a bend. So, if this particular ureter is falling without making a flip or making a bend, that means you have hold it in right position, upper pole and lower pole. Let me explain. Now, if you identify this particular kidney, first thing you are going to identify the ureter along with the pelvis. Identify the things first. You see that? This is hilum. Clear? This could be upper pole, this could be lower pole. Now, what I am doing here? I am holding it in a position where to identify this particular one. Which is this one? This ureter with hilum, which renal pelvis which is going on. So, this ureter is placed on the posterior side. This is on the posterior side, rightly placed, and this is on the anterior side. So, this is vein, artery and pelvis. So, this is anterior, this is posterior. Then, this is upper, this is lower. Because this particular hilum and along with this ureter is dropping down without any bend. It's natural. Now, what happens if I flip it? By mistake, if I am holding it, upper pole as lower pole, what happens? It is bended, it is not flowing. That means I am holding it in a faulty position. Then it is. Then I am going for side determination. Upper pole, lower pole, medial, lateral, anterior, posterior. Which side kidney it would be? This is my right side kidney. Now, how this kidney is going to be? Upper pole will be medially back. Get it? Again, upper pole, lower pole, lateral, medial, and anterior surface, posterior surface. Posterior surface should be flatter compared to the anterior one, but maybe variants may be there during examination, or sometimes the kidney may not have that variability like flatness or bumpy, so that may not be there. The best thing to identify this, the hilum structure. Now, what are the relationship of the hilum structure? Vein, artery, pelvis. So, pelvis will be most posterior. So, you will be identifying the pelvis with the ureter first. Have you identified the pelvis with the ureter? Then place this particular ureter on the back side. Then you see that whether this particular pelvis is dropping freely or not. If it having any bend or not, it is dropping naturally, no bend whatsoever. That means it's a normal in position. That means this mix, upper pole is normal, right? Lower pole, anterior posterior is ideal. Now cross verify it. देखिए तो उल्टे क्या है? Is dropping down with a bend, so it's not falling properly. So that means আগেরটাই ঠিক position ছিল. So we reconfirm it and do it. So right side kidney, left side kidney, the structures of this region remains there. Now what I am saying this, the pelvis is the guide. The relationship what I am saying is vein, artery and pelvis. Now what happens, a branch of artery and a branch of renal vein may be mixed up or may be interchanged. A branch of it, what I am saying, a branch of it. The renal artery splits into 4 and 5 branches. The 4 and 5 branches which is coming to the hilum, or before it enters to the hilum, it may be branched. So that is why the main renal artery you may not be able to identify. Branches you are seeing. The branches of this particular renal artery may be anterior or posterior, may be switchable in position. So that is why judging this particular renal artery, renal vein in a position of the hilum of the kidney, specifically in the organs, may be have errors in proper identifications. So the only constant feature out of these 3 is the hilum of the kidney along with this renal pelvis ureter, that is most posterior to it. So this posterior one you identify first, then make sure the posterior one is posteriorly placed, and then you tell about this particular logical structure anterior to posterior. Then you see that particular posterior structure which is dropping down freely or not. If it is a free drop structure, no bend, it will be in right in position. Then you tilt it accordingly with the axis, longitudinal and transverse, and then have it in anatomical position.